tonight will be Dr. Benjamin Schwartz, who is the Director of Epidemiology and Population Health with Fairfax County Health Department. This is a Faith Communities in Action meeting, and we have invited the larger community to participate in this meeting, given the nature of this topic and the importance of the information that Dr. Schwartz will have to share with us today. I would like to share with you some some housekeeping skills as we go forward in this COVID environment. Tonight's session is being recorded. All users are muted. Please submit any questions that you may have in the chat box or click raise the hand button. Poll responses are anonymous. We will have one poll today to get a feel for the temperature in the room and your views about the vaccine. All of these responses will be anonymous. Resources will be provided at the conclusion of the event by email to all registered attendees. A post-event survey will be included in the email with COVID-19 resources. We appreciate your feedback and hope that you will take the time to fill that out. Now I'm going to ask that Rabbi Abby Sharovsky will open us up in prayer.
Thank you, Ramona. Welcome to everyone who is here today. I hope everyone is well, and join me in praying in a way that you are comfortable. O Creator of us all, we ask for your blessings at this time. We ask that we are granted strength as we move through this season of light. We ask that we are granted health and that we are granted patience as this new vaccine is being rolled out to our world. We thank the doctors, we thank the researchers, and we thank you for allowing us to reach this point. And we pray for continued strength and continued understanding as we move through this pandemic. We pray for the healing of all of those who have been impacted by this pandemic. And we ask that a full healing, a refuah shlema, a healing of mind and body and spirit, reach us all. Thank you. Amen. And now a poll is going to pop up. Please take a moment to complete it. All right, thank you for taking the time to complete that. I am now honored to introduce Sharon Arndt, the Director of Community Health Development for Fairfax County, for the Fairfax County Health Department.
Good evening, everyone, and thank you for joining us tonight. I am Sharon Arndt, Director of Community Health Development for the Health Department, as I was introduced. My work during this pandemic is to serve as liaison officer for community and nonprofit organizations. And I do have the honor of working with Ramona on a regular basis and making sure you all are connected to the resources you need. So thank you for joining us tonight. And I'm pleased to introduce you to Dr. Benjamin Schwartz, who is our Director of Epidemiology and Population Health at the Health Department, and he serves as the Deputy Incident Commander of our response. So Dr. Schwartz.
Great, thank you so much, Sharon. And thank you for sharing those poll results. Can you just go back one slide? And okay. So first of all, before I start, I just want to thank all of you for the work that you've done during the pandemic. We know that this pandemic has created incredible needs in our communities, and that the work that you do, working with people, helping them meet their needs, their faith needs as well as their physical needs, has been so important with all the stress that we've had, all the illness that we've had in our community. So I really want to thank you all for the work, the hard work that you've been doing, and say how much I appreciate it, and will hope that I can share some information with you about vaccines and vaccination that can provide a little bit of a light at the end of this very long tunnel. So what I'd like to do tonight is to begin with a very brief update on coronavirus disease in Fairfax County. Then I'm going to talk about the vaccines that have been developed, talk about vaccination, the process of getting those vaccines, and then provide a little bit of information on logistics and planning in Fairfax County. But really important is to have time to answer all of your questions. So we'll definitely have some time for that as well. So next slide. These data are from the Virginia Department of Health dashboard and describe the number of cases we've had in Fairfax County over time during this pandemic, as well as the test positivity rate, which is another metric that people commonly follow. You can see that there was an initial peak of disease that occurred in the spring, peaking at the end of May. And after that time, the cases in Fairfax County went way down and stayed down over the summer. So whereas many other jurisdictions around our country experienced a wave during the summer, in Fairfax County, we didn't have that wave. And I think it really reflects the really great work that people in our communities were doing, promoting various mitigation measures, wearing masks, social distancing, staying away from others if you're sick. And so that really spared us the summer peak that was seen in so many other jurisdictions. But unfortunately, this fall, we've seen an increase in disease that has been seen almost everywhere else. So that in mid-October, you can see the increase began. And now we have more cases occurring than at any time previously during the pandemic. We've also seen our test positivity rate, which reached a low point, a nadir of 3.4%, has gone up to 10.9% despite increased testing. And that's just another measure of how much more frequent disease has become. We don't know how long this fall and winter peak of disease is going to last. But the University of Virginia has done some mathematical modeling, and they are predicting that in Northern Virginia, we may see this wave peaking sometime toward the end of January or beginning of February. So we may still have a ways to go before we've reached our peak for the current disease wave. Next slide. So why are cases increasing, not just here, but in so many other jurisdictions? And there are several potential explanations. One is that people are spending more time indoors as the weather gets cold, and we know that the risk of getting infected indoors is much greater than if there's contact outside. Families are getting together both for the holidays, but just also because it's so difficult for families to stay apart for these many months. Increased travel related to the holidays may be a factor, as well as increased attendance at restaurants, gyms, and in other locations. But all of this might just come under the category of mitigation fatigue. People are doing the best they can, but it's really difficult to rigorously maintain all the mitigation measures as the months go by. Next slide. So in Fairfax County, our Fairfax County Health Department dashboard shows that almost 38,000 cases have occurred in the county. But we know this is an underestimate of the true impact of disease in our communities. The Virginia Department of Health estimates that for every case that is identified and confirmed by a test, There may be a couple other cases that are not even identified, so that the true number may be 3 times what we see on the dashboard, and perhaps is over 100,000 people in Fairfax County, or about 8% of our population. Now, the good news is these 8% may have some level of immunity from having been infected, but the corollary is that more than 90% of people in Fairfax County are still susceptible to COVID, hence the importance of vaccination for our community. Next slide. When one gets vaccinated, there are 2 types of protection. There is individual protection, and if we reach a high enough level of vaccination, there is community protection. Vaccination protects individuals. When the vaccinated person develops immunity, they develop antibodies to the virus that keep the infection from occurring. Vaccination also can protect communities when enough people develop immunity so that infection is less able to spread. And this is something that's called herd immunity. For COVID-19, herd immunity or community immunity is thought to occur after about 60 to 70% of the population is immune. So in the figure, what you see is that if everybody's susceptible, you get these long chains of transmission from person to person to person. But when many people in the population, not all of them, but when many people have immunity, those longer chains can't occur because the people you come in contact with are likely to be immune. Now, one thing that's important to emphasize about herd immunity is that this is not just some average figure across our entire population, but within each community, we have to reach this 60 to 70%. So if we're above that, say in South County, but we're below 70% in Mount Vernon will not have the same degree of herd immunity. So we really need to care about all of our populations, not just the average of everybody within Fairfax County or Northern Virginia. Next slide. So the key point that I really want to make is having a safe and effective vaccine is really only part of the equation. It takes both vaccine as well as vaccination for us to achieve this individual and community protection. Next slide. So we are fortunate in that we have a robust scientific community, and many companies have been working very hard on vaccine development. And the way they do this is through a sequence of vaccine trials. Those trials begin with preclinical studies that occur in animals and laboratories and then in animals, and then a series of human trials that begin with phase 1 studies, which are safety studies that occur in a very small number of volunteers. Then phase 2 studies that continue to look at safety, but also look at the immune response from the vaccine and what the best dose of the vaccine is. And those studies take place in hundreds of volunteers. And then the phase 3 studies that we've heard so much about recently, which continue to look at safety as well as efficacy in thousands of volunteers. And these are studies that compare the vaccine with a placebo so that you can see what the effect of the vaccine is compared with people who did not get the vaccine. Of note, there are no children less than age 16 who have been included in the initial phase 3 vaccine trials. And so the initial recommendations for vaccine will not include children younger than 16 years of age. Next slide. There are several leading vaccine candidates that have been assessed in these phase 3 trials. The Pfizer vaccine has already been approved by the FDA and recommended by CDC. And in fact, that's been shipped. And some people in Fairfax County have already been able to get that vaccine. The Moderna vaccine is being reviewed by the FDA's advisory committee our advisory committee today. And if it's approved over the weekend, will be reviewed by the CDC and hopefully recommended before next week. AstraZeneca has released some preliminary results of trials that were done outside the US, and they're beginning a US trial. And then Johnson & Johnson and Novavax trials also have been ongoing. Next slide. Because the mRNA vaccines are the technology that is going to be approved, I wanted to share a little bit of information on how mRNA vaccines work. The mRNA is codes for information on the formation of the spike protein from the coronavirus, which is an immunogenic protein on the surface of that virus. The messenger RNA, in other words, the code for the spike protein, is included in a lipid nanoparticle in the vaccine. And so when you get the shot, those nanoparticles go into your body, they are taken up by the cells in your body, and then they induce the cellular machinery, if you remember high school biology, the ribosomes, to produce the spike protein, which is then displayed on the surface of our cells. That spike protein then induces an antibody response from the B cells and the helper T cells. There are three things that are really important to emphasize about mRNA vaccines. The first is that there is no live virus in these vaccines, so that it is absolutely impossible, zero risk of getting COVID from the vaccine. Secondly, the mRNA remains in the cytoplasm of the cells. It does not go into the nucleus. And what that means is that there is absolutely no risk of it affecting our DNA or causing any mutations. So anytime we talk about genetic material, that might be a fear people have, but again, no risk of influencing our DNA. And finally, the mRNA degrades over several weeks so that it has no long-term impacts on the cells in our body. Next slide. This slide compares the results of the phase 3 trials from the Pfizer and the Moderna vaccine. So the Pfizer vaccine included 43,000 participants, Moderna's 30,000 participants, and as I mentioned, half of them received vaccine and half placebo. Both vaccines are extremely effective with efficacy in the mid-90% range. And importantly, virtually all of the cases of severe disease in the trial occurred in the placebo group. And what that means is that for the few people who get vaccinated and develop disease anyway, that disease is likely to be less severe. So that vaccine not only protects against infection, but probably also protects against more severe disease for those who do get infected. Both trials included adults of every age, males and females, and various racial and ethnic groups, and the vaccine was equally effective across these different populations. Neither study identified any serious safety concerns, although local reactions occurred commonly and more commonly with the second dose. And when I say local reactions, I mean some pain, maybe some redness at the site where the vaccine is injected, and for some people, flu-like symptoms, headache, fever, muscle aches, but those generally lasted only a day or two. So a little bit of reactogenicity, but no serious safety concerns. Pfizer estimates that they will have 50 million doses by the end of the year that they can distribute, and Moderna another 15 million doses. Next slide. The vaccine is administered as a 2-dose series. For Pfizer, it's 3 weeks apart, and Moderna, it's 4 weeks apart, and both doses are needed for full protection. As I mentioned, the Pfizer vaccine has already been approved for people 16 years of age and older, and the vaccine may be administered to people who have underlying medical conditions who have no contraindications. and the only current contraindication is severe allergic reaction to a vaccine component. And the clinical trials that occurred did include people with underlying medical diseases. And then finally, even after one has been vaccinated, those individuals should continue to follow all current mitigation guidance until we learn more about the vaccine protecting against infection and transmission. Next slide. When the vaccine is first introduced, as I mentioned, the supply is going to be limited so that the vaccination is going to be targeted or prioritized to certain groups. CDC's advisory committee, the Advisory Committee on Immunization Practices, has recommended initial vaccination for phase 1A to include healthcare personnel and long-term care facility staff and residents. Phase 1B includes essential workers in sectors that are yet to be fully defined, but will likely include education, food and agriculture, utilities, public safety, and transportation. And then following that group will be adults with high-risk medical conditions and those who are 65 years of age and older. The first phase, 1A healthcare personnel and long-term care facility residents, represents about 5% of our population. Phase 1B may be another 20%, and phase 1C over 30% of the population. So you can see that by the time we get through these phases to everybody else, we're likely to have vaccinated more than half of the people who choose to be vaccinated in our county. Next slide. And here's some of the percentages that I just had mentioned. Obviously, there's overlap between these groups so that some of the essential workers may have high-risk medical conditions. Obviously, some people with high-risk conditions will be older as well. So that's just kind of a snapshot on these populations. Next slide. Now, as I mentioned, it's important not only to have a safe, effective vaccine, but people also need to want to take that vaccine. I worked with a group from Johns Hopkins University with in a project that was funded by the Robert Wood Johnson Foundation. And as part of this project, we did a national survey with over 2,500 respondents. We oversampled the African American and Hispanic populations, so we have good estimates for those two groups, and then weighted the data in order to be nationally representative. And here's what we found. We asked people if vaccine was available today and it was free of charge, would you get vaccinated? And to that question, half of the population, 51%, responded that they would either definitely or probably get vaccinated as soon as possible. So half of our population is clearly very motivated, and all they need in order to get vaccinated is access to the vaccine. They need to know the vaccine is available, when and where to get it, and they are motivated to do that. So that's half of our population. Shown in yellow is another group. And this is people who said they would probably get vaccinated, but not right away. And those who said they would probably not get vaccinated. So this is a group that I would call uncertain or wait and learn. People who need to learn more in order to make up their mind about vaccination. And that represents 40% of our population. And then the third group is people who responded they definitely would not get vaccinated. And these may be more people who have more concerns about vaccine and would be very difficult to convince to get immunized. So next slide. So I really want to emphasize this middle group, which we're calling the wait and learn population, because this really has to be a focus for our communication and outreach. This is a population who we need to talk to and give them the information they need to make a good decision for themselves and their families. And so really respecting this wait and learn attitude and helping them get the information they need. I also want to point out that in the African American population, this represents over 50%. So we know with the systemic racism in our community, we know with the history of the African American population and experimentation and with government and the medical community, that we have more skepticism in this population. So we have to work extra hard to address people's needs, to give them the information that they need. Next slide. In addition to the survey, part of this project was to hold community conversations. And we did so in Hispanic communities, in African American communities, in Native American communities around the country, as well as some online conversations with people who had responded to our survey. And we asked people to share with us some words that they think of when they think about COVID vaccine. And those are shown here. So some of them are really very positive, amazed, excited, hopeful. But also some of them really communicate the concern that people are feeling. Anxious, concerned, hesitant, skeptical. And so again, highlighting the work that we have to do for people to get the vaccine. Next slide. We asked in our conversations and in the survey, what's important, particularly for those people who fall into the wait and learn group. And here's what we're finding. We're finding that many people are still forming their views and need more information. We found concerns about vaccine safety. We found that numbers matter. People want to see millions of others who get vaccine first so that they can learn from that experience. There is a significant portion of our population who expresses a lack of trust in government and in pharma. There is confusion due to changing or conflicting information, and we know how frequently that's been a problem during this pandemic as policies and information have changed. The perceived risk that people face is something that's important to them, and then getting back to normal is something that we also frequently heard. Next slide. I want to address two of the concerns and just kind of share some ideas about how we can respond to people who have these concerns. So many people have concern about the speed of vaccine development, and they'll ask, a new vaccine usually takes years to develop. Why was this so fast? Were there any corners that were cut? And so to answer that question, I might say the following. First, that the mRNA vaccine technology has in fact been developed over many years and therefore was ready to be applied once the pandemic occurred and once we knew about this new coronavirus. So it's actually not as fast as people perceive it to be. This technology has been in the development process for years. Secondly, government funding also has made the process much more efficient. And so because of that increased funding, the companies then could do their work more efficiently and more quickly. And finally, it's important to emphasize that there were no steps that were skipped, there were no corners that were cut, and the same rigorous clinical studies and approval process took place as take place with any vaccine. Next slide. People also ask, what do we know about the safety of vaccines? And as I mentioned, the clinical trials did show that vaccine reactions such as pain at the injection site or headache and fatigue lasting for a couple days may often occur. And I think we need to honestly communicate with people that this is something that if it occurs is not abnormal. This is something that can be expected to occur with this vaccine. That said, there have been no serious side effects that were identified in the clinical trials. As I mentioned, the vaccine does not include live virus, so you can't get COVID-19 from the vaccine. And further surveillance is going to be done to identify any unknown or longer-term side effects as people get vaccinated. And this is exactly the same process as occurs with other vaccines. Next slide. We asked people in our conversations what were their trusted sources of information. And many people said it was their own healthcare provider. Many people, particularly in Fairfax County, and this is really a testament to the good work that Sharon and her team, the outreach team, have been doing. Many people did mention our local health department, and then less frequently national figures, Dr. Fauci and CDC. So I really want to emphasize one of the things that we heard strongly is the importance of local information. Information from our friends, our neighbors, our doctors, our health department, information that's transmitted not by communicators, not by marketers, but by people who we know, who we trust, who are in our community. And by saying that, I'm describing all of you. And I'm describing the work that you do. You are the important ambassadors for vaccination. So it's important that you know and that you have your questions answered so that in turn you can effectively share information with our communities and hopefully give people the information they need as they make decisions. Next slide. And so I just wanted to share a very brief comment on vaccine administration. So Fairfax County Health Department will be administering vaccine, and will be doing so from a number of sites around the county. Hospitals are currently vaccinating their staff, but private healthcare providers also will be providing a large portion of the vaccine, because we know that people trust their providers and they want to get vaccinated by their providers. So the Virginia Department of Health has a system where providers who want to administer vaccine can register. And if there are any healthcare providers on this call and are interested in doing that, we can share more information. And then national pharmacy chains like Walgreens and CVS also will be administering vaccines. So by the time that vaccine is available broadly to phase 1B, phase 1C, and more broadly to the general population, you can see that there are going to be many, many sites where people can get vaccinated around our community. So again, I want to thank you all for the work that you're doing and stop here and answer any questions that people have. And I know a number of those questions were submitted in advance. And Sharon, if you could do the honors of kind of asking questions that people have and that they've submitted in the chat box.
Sure. Well, why don't we start with the questions that were submitted in advance, and then we'll progress to the chat box. So Dr. Ben, there were a few questions around protective behaviors. And one was, what are your suggestions for supporting older adults to stay connected to their faith communities?
Yeah, so certainly staying connected, but staying safe are both two of our priorities. I think there are ways to connect online. I think that if one goes to services, making sure that that's done safely with effective social distancing and effective mask wearing. I know when I've gone to services at my synagogue, I've reminded people that the mask needs to cover not only their mouth, but also their nose. And so making sure that people do the mitigation measures as rigorously as they can. I think that's important. Everybody needs to balance for themselves what risk they want to take and what benefits they get from various activities. So I think that's the best I can say there.
Okay. And we did receive a question around protective behaviors for an individual who resides in a high-rise condo with shared elevators and common areas. There have been numerous residents as well as employees who have contacted COVID-19? Other than the suggested safety measures, is there anything else I can do to protect myself? And I do want to
Yeah.
mention that I will post in the chat the guidance from the CDC for those who may live in shared housing and coping with daily life.
So I want to just add one pearl to the things that people have commonly heard. And that is, everybody knows we need to wear masks, we need to be socially distanced, but we're also concerned. So when we press that button on the elevator and we think, oh my gosh, now maybe I've got COVID on my finger. What's important is not whether you get COVID on your hands or not, but you need to keep your hands away from your face, right? So the only way that you can get infected is if COVID gets into your eyes, into your nose, or into your mouth. And so if you do touch something, like you touch the elevator button or you touch a door to go into your condo, just make sure you don't touch your face until you've had an opportunity to wash your hands or use hand sanitizer. And that will keep you from getting infected. It's not what gets on your hands, it's what gets into your mucous membrane. And so just make sure you wash your hands really well before you eat or before you touch your eyes, nose, or mouth.
Thank you. We did receive a question about testing. If someone has never been tested for COVID-19, what are your thoughts about the approved FDA home testing kits that not only allow you to take the test at home, but also receive the results at home instead of sending the test out?
So those were tests that were just approved, and I think they sound like a really good option, but I've also heard that the supply is going to be limited. So unfortunately, I don't think that this is going to be an entire solution to our testing issues. But certainly if you can get those tests, I think that's very, very reasonable to do so. Testing is how people can find out if they're infected, but even better is just being as rigorous as you can be in terms of prevention.
Now, we do have a few questions about vaccine effectiveness. You may have answered some in your presentation, but the first one is, what and how long are the side effects after taking the vaccine?
Yeah, so I really want to kind of distinguish in people's minds kind of serious side effects, which are something that people wonder about and that they think, wow, that I wonder what the vaccine's going to do. I want to separate that from reactions because it's normal to to have a reaction to the vaccine with a little bit of pain, a little bit of soreness. Your arm might ache a little bit. You might have some pain in that muscle. And I just really want to emphasize that those kind of reactions go along with the vaccine working in your body, that really it's doing what it's supposed to do. So I want to separate that from the occurrence of longer term or unknown side effects. As I mentioned in the presentation, in the clinical trials that were done, there were no signals for serious adverse events. Now, since the vaccine has been given, we've heard about a few people who have had allergic reactions to vaccine. And I can tell you that when the health department, when a hospital or a medical provider administers the vaccine, they are fully equipped to take care of any allergic reaction that may occur. But other than that, I haven't heard of any serious side effects that occur with these vaccines.
Thank you. Another question is, what is the estimated length of time for which the vaccine provides protection?
We don't know how long vaccine will be protective for. That's only something that we can learn over time. So that scientists are going to continue to investigate the effectiveness of vaccine. My guess is that people probably will have to get a booster at some point in their lives, but that's just a guess.
So this is a related question to your previous answer. Will this be a yearly vaccine?
Yeah, we certainly don't know how frequently vaccine may be needed in order for people to remain protected.
And is this a vaccine which will be covered by the government indefinitely?
Well, the word indefinitely is the kicker there. So at least at this point, there are no costs associated with getting vaccinated. So the government is covering the cost of vaccine. And if people have insurance, that insurance will cover the cost of administration. If people don't have insurance, there are no administration costs. So nobody should have to pay anything out of pocket to be vaccinated. I don't know if that will go on indefinitely. I would guess probably not, but again, I don't have any specific knowledge.
So, Dr. Ben, we received many questions in advance and then I think in the chat today about vaccine prioritization. So there's a few here. How and when will vaccine be available for active seniors?
For active seniors, that would be in phase 1C. And when will that occur? I have to say, I don't know for sure. If I were going to guess, it might be toward the beginning of the spring. But again, that would just be a guess.
The question about when will vaccine be available for students?
Depends on the age of the student. So again, we don't know if the vaccine is safe and effective in persons younger than 16 because that hasn't been studied yet. I know the companies are currently in the process of doing those studies, and so we need to wait and see what that shows.
So question about where people are, where are people who are in jail or in prison on the vaccine priority list?
We know that the people who work at the prison are in phase 1B, and I'm not sure where the inmates would fall on the priority list, but they are also somewhere in phase 1. I can try and find out more about that.
So what about folks who work in healthcare settings like housekeeping and food service staff? Where are they?
Yeah, you know, one of the things we want to make sure of is that there's equity in who gets vaccinated. And certainly it would not be equitable if it were only the doctors and nurses who got vaccines. So it's really everybody who works in a healthcare facility, whether they are staff who work in food service, whether they are maintenance staff, anyone who may potentially be exposed.
Questions, where do clergy or religious school teachers fit in terms of getting access to the vaccine?
You know, I haven't heard a discussion of clergy in particular. Educators, you might consider clergy to be educators, are in phase 1B, but that's a question that I haven't heard come up before, and unfortunately, I can't give you an answer there.
And there's a general question of how will we find out when it's our turn? So I will post in the chat the Fairfax County vaccine webpage, but Dr. Ben, do you know how the health department will be sharing that information?
Yeah, I think that's really important because, you know, for everybody who wants to get vaccine, they need to know when it's their turn and when and where. That's going to be communicated broadly by the health department. I don't know the specific approaches to communications, but if any of you were here in 2009 and remember the vaccination for the influenza pandemic that occurred that year, that might give you an indication of how the health department is going to communicate who should be coming for vaccination.
All right. Is there a plan, or where will staff members who work at essential human service provider organizations be in the prioritization list?
They should be among the essential workforce, and that's something that we're going to make sure happens, because we know that so much of the work that is done in our communities obviously is essential to our population.
Right. Well, as a nonprofit organization charged with day programs, occupational therapists and assisted therapies, vocational rehab, and case management for individuals with a brain injury, how do we get qualified as frontline workers who serve a vulnerable population?
Yeah, therapists have been specifically identified as being included in Phase 1A. So if you provide healthcare services in therapy or rehab, that would certainly qualify as a healthcare worker.
What are the protocol or qualifiers for organizations who serve vulnerable populations through care-based facilities other than long-term care or assisted living to be considered for the vaccine?
I know that congregate facilities for people who have a range of disabilities or behavioral health issues are included among the priorities. I'm not sure if there are other groups that you were thinking of in that question.
When will Fairfax County provide a listing of groups eligible for the vaccine so that residents know which group they will be included?
So even we don't know who's going to fall within the essential worker, or I think we've got a pretty good idea of who's at high risk. But those recommendations will be made by the Advisory Committee on Immunization Practices, which is a CDC advisory committee. And once they make those recommendations, we obviously will communicate it widely.
So now we have a few questions here about vaccine participation. What are the expected rates of vaccination, as in how many residents do you think will get vaccinated?
I think the answer to that question depends on how well and effectively we can meet the needs of the wait and learn group. So we know that's a large portion of our population, and we clearly need to be able to answer the questions that they're asking, as well as making vaccine easy for people to get. So I can't predict what the coverage is going to be. I do want to share that influenza vaccine coverage has been about 50%, and we clearly need to do better than we do with flu vaccine.
Are there any plans in place to encourage more residents to participate, perhaps a non-financial incentive?
Yeah, unfortunately, we don't have the ability to provide incentives, but I do think that people's own motivation and their interest in protecting themselves and their families, their communities, and getting back to normal, hopefully we can emphasize those things that people value as the incentive.
And can you address what might be done to address the mistrust in the Black community around the vaccine?
Yeah, that is so important. And I really think that maybe is a question that I should be asking you and understanding and learning from you. We also are, we had a good conversation earlier today with our outreach team, and we discussed that specific question. I think what we need to do is acknowledge the basis for the mistrust and the concern, and really recognize why the community is concerned, and really, provide information clearly, transparently, and authentically. And I think that will go a long way. I think also it will take people who are trusted by the community as providing that information. And so that's something where our outreach team, but also where the work that all of you do may come in. But that's definitely a high priority for all of us.
So Dr. Ben, now I am going to try to ask you some of these questions here in the chat. They're not as organized as the ones I had just asked you. And just to let everyone know that it is 5:52, so we may not be able to answer all of your questions, but we will do our best.
And I don't know if 6 o'clock is a hard stop, but I'm happy to answer questions as long as you think is appropriate.
Okay, thank you. So one of the questions is, to what extent does the vaccine prevent infection versus simply preventing clinical illness?
Well, we know it certainly prevents clinical illness. That's what we've learned from the studies. Other vaccines, and by extrapolation, we believe this vaccine also will prevent infection and transmission of that infection. So I think scientists are pretty certain that that will occur, although we have no direct evidence yet at this point.
If children have not been included in the trials, then how can we advise our school system?
You know, we've worked closely with the SRS program in Fairfax County. So SRS is a neighborhood and community services program supporting return to school. And they've had between 1,000 and 1,500 students in 38 different sites around the county. And one of the things that we've learned from that program is that most of the time, it's not the children who are infected, but it's the adults. It's the teachers, it's other staff who bring the infection into the building. Now, fortunately, there hasn't been any evidence of any transmission of coronavirus as part of that program. But I think that one of the things is that just protecting the adults, the staff, and the teachers is going to go a long, long way toward making our schools much safer for everybody. And then, as I said, children will be in line for vaccination. We just don't know when.
The current vaccines are aimed at the current version of the virus. What if it mutates? Does that render the vaccine useless?
That probably isn't going to happen. Flu vaccine is one of those vaccines. Influenza changes frequently. There are these recombination events, not just mutations, but something called recombination. And therefore, we need to come up with new vaccines each year. We haven't seen that kind of behavior with coronavirus. So it's likely that the vaccine that we have now is going to continue to be effective, but that's obviously something that scientists need to continue to study.
Is there any way to predict if someone might have a severe allergic reaction?
Not that I know of. The recommendation or the contraindication is an allergy to a vaccine component. And I really don't know how that would be predicted in advance. But I do want to assure people that in any vaccination site, and particularly those sites run by the health department, we do have the capabilities to respond appropriately if a reaction does occur.
So once the vaccine is shipped, are there controls on whether the vaccine actually goes to the priority populations? Who is making these decisions at the local level?
Yeah, to a large extent, being part of a priority population is going to be on the honor system. And so when you register, and vaccine's going to be given by appointment from the health department. So when you register for vaccination, you'll be asked what priority group you're part of. And hopefully people will be honest and say, this group or that group. And so, but we're not going to check IDs. We're not going to compare with lists that we get from, schools or hospitals or whatever. We believe people are basically honest and are going to be willing to wait their turn.
There's a question here that says that there is no FDA-approved vaccine to prevent COVID-19. Can you address the status of approval?
FDA has issued an emergency use authorization for the Pfizer vaccine. So that has been approved and it's been administered, including in Fairfax County. The vaccine and related products, VRBPAC, Vaccine and Related Biological Products Advisory Committee, is meeting today. And they're the FDA advisory committee that will advise FDA on the Moderna vaccine. And so FDA should be making its decision most likely tomorrow on that vaccine.
Is the mRNA the best type? What if it's not available once it's your turn and your only option is the live virus?
So the leading vaccine technologies do not include the live coronavirus. So the two vaccines that we've already learned about are mRNA vaccines. Then there are two vaccines that use a non-human adenovirus as a vector, in other words, as a carrier for that spike protein from the coronavirus. But those vaccines also do not include the coronavirus. The other vaccine technology I mentioned was a nanoparticle, and that also just includes the protein. So none of the leading vaccine candidates are live virus.
So, Dr. Ben, can you address the anticipated timeline for the various phases in Fairfax County? I know earlier you mentioned older adults, but.
Yeah, I should be too hesitant to step out on this ledge because there's so much we don't know about, how much vaccine is contracted for. I'm sure you've all read in the newspapers that we've contracted for some millions of doses of Pfizer vaccine, and then the government is currently in the process of negotiating getting more vaccine from Pfizer. So there's really a lot of uncertainty there. I think what many people are saying is that, healthcare workers probably now through January, maybe we can start targeting some of those other priority groups later in the winter as we go into the spring, and then probably the broader population in our community as we get toward the summer. There's still a long way to go.
If you have had COVID and an antibody test indicates that the antibodies are high, is it necessary to have the vaccine?
So what CDC tells us is that people who have antibodies generally are protected for at least 3 months. So if you had recently been infected and wanted to give up your place in line to someone else and get vaccinated later, that would be okay. But everybody, even those who have had disease before, are recommended to get vaccinated.
Is there a reason a person should not be vaccinated based on any presenting condition or blood type?
Not that we know of. None of those have been identified as contraindications or precautions. Pregnant women have not been included in the vaccine trials, but because of the effects of COVID disease on women and the fetus, it's recommended that they talk with their healthcare provider about getting vaccine. And so pregnant women are able to get vaccine. There's no reason to think that vaccination would be a problem for lactating women. And then people who are immunocompromised, there also is not specific data on the effectiveness of vaccine or its safety in this population. But again, because of the higher risk of severe COVID disease, people with immunocompromising conditions should talk with their healthcare provider and are able to get vaccinated.
How much more intense have side effects been compared to ordinary flu shots in past years?
I think probably the best comparison with this vaccine in terms of kind of reaction, sore arms, and maybe a little bit of headache or muscle aches would be the new shingles vaccine. Has anyone else gotten that vaccine? Yeah, I got it too, and it certainly wasn't pleasant to get. My arm was sore. I did feel kind of miserable for one day. but after that, it was just fine. And I think that those reactions are not going to be uncommon with this vaccine. But again, I think for having the ability to prevent this severe disease, but also to give us the herd immunity that's going to protect our entire community, I think that on balance, getting vaccine and experiencing a little bit of soreness is okay.
If a vaccine is given at a pharmacy, who will manage the time required to observe the patient after the injection is given?
Yeah, I think it is important to wait for about 15 minutes after getting vaccinated, just to make sure that there isn't an allergic reaction. And I would expect that any pharmacies that are administering vaccine would provide that waiting space for you.
There's a question of the other ingredients in the vaccine so individuals can understand if they might have an allergy to them. So will the ingredients be posted somewhere?
They will be, and I looked through the ingredients, and they were all a bunch of chemicals, and I can't imagine someone knowing if they were allergic to this or that. Actually, I don't want to overstate it. There are not that many ingredients in the vaccine, and I know that there's a preservative that many parents were worried about with childhood vaccines, and these vaccines are preservative free. So the thimerosal, which many people were concerned about a number of years ago, is not a constituent of this vaccine.
Right. Related to the prioritization, who is the arbiter of who is in which group?
Those groups are going to be defined. They're going to be defined by the Advisory Committee on Immunization Practice. Then we're going to have to sub-prioritize, because obviously we can't vaccinate 15, 20% of the Fairfax County population at once. So we may have to say this week and next week, we're going to start vaccinating teachers, and then we're going to start vaccinating transportation workers or whatever. But all of those will be defined. And we're all going to have the same priorities across Virginia, across Northern Virginia. So it doesn't matter if you're a teacher in Fairfax or if you live in Loudoun County, but hopefully we'll all be having the same priority groups at the same times.
It's a question related to those who may be volunteering to give out vaccines. What will be done to protect the people who meet high-risk requirements that are volunteering and giving out vaccines?
So people giving out vaccine will be vaccinated themselves as healthcare providers.
Boy, Dr. Ben, everybody wants to save your presentation. Lots of questions about recording.
Yeah, I think that the presentation is being recorded, and so I know that will be accessible.
I think we addressed this before, but how long after the 2 doses does the vaccine last?
Let me change the question a little bit. How long after the second dose is it before one is fully protected? And the answer is 1 to 2 weeks. So 1 to 2 weeks after getting that second dose, you can be confident that you've achieved the protection from the vaccine. We don't know how long that protection is going to last, whether it's going to be a year or several years. That's something we still need to learn.
And is there a protection after the first dose?
The study that Pfizer reported said that there was 52% protection after the first dose. But we only know about that protection occurring during the 3 weeks before they received a second dose. So there is some protection from a first dose, 50% or so, but we don't know how long that protection would last.
There's a couple questions here about the safety of the supply chain. So how will we know that the vaccine hasn't gotten too warm before it's delivered or before it's been administered?
Yeah, there are cold chain monitors that are used throughout the process, and this is very similar to other vaccines that are normally given to children and adults as well. So that healthcare providers, the health department, we're all very familiar with managing cold chain and assuring that there are no breaks in that cold chain.
So there's some, just some, going back to the volunteer question for some clarity. Should a potential volunteer wait 5 to 6 weeks after getting the vaccine before administering to others?
No, I don't think that's necessary because the volunteers who are giving vaccine also will be protected with personal protective equipment with, and so given the PPE, given the precautions that people will be taking, I know that our people who are administering vaccines will be able to do that.
All right, so we have reached the end of the questions, and Dr. Ben, so
Wow, that was easy. Come on, give me some more. You know, you can see from the answers that we don't know everything yet, but again, I want to emphasize, you know, honest, transparent, authentic information, acknowledging what we know, acknowledging what we don't know, and giving people the information they need to make the best decisions. And I hope this has been helpful for you so that you can help talk to people as well.
So at this time, I would like to pass the microphone over to Pastor Barbara Breland, who will offer a closing prayer.
Okay. Good afternoon. Good evening, everyone. Thank you, Sharon. And thank you, Dr. Schwartz, for your informative presentation. Ms. Ramona Carroll has asked me to remind everyone that you will receive in an email a survey and some additional resources about this information. So if all hearts and minds are clear, let's look to God. Oh God, our creator and our sustainer, the one in whose hands we belong. God, we thank you for this presentation this evening. We thank you for all of the work that has been done on the COVID-19 vaccine and how you have equipped men and women to be the vessels to bring about this healing. You are the source, but they are the instruments. So now, God, we ask that you would bless every household, every house of worship that is on this call tonight, and be with us as we go throughout this time. God, keep us all safe and in your care. It is in your son's name that we pray. Amen. Go in peace.
Thank you, everyone. Be well.
Thank you.